Hello everyone, and welcome to online repertory training course ORTC 2023. Myself Dr. Yamini Ramesh, and I welcome you on the behalf of whole team of ORTC. And this course, as you know, that is created by Dr. Ghanshyam Galatia sir. So let's start today's video. So I feel a lot of privilege while sharing uh, my cases with you, and also whatever I know about repertory and repertorization. I'm really thankful to Dr. Ghanshyam Galatia for giving me this opportunity. And few years back I joined this course as a student, and it was such a great opportunity because I have learned a lot. And this learning is ongoing. It happens every year, and this is a great opportunity for all of us to to learn something new, and to go through different repertories through different masters. So today I'm going to share something about clinical repertories. We always talk about rubric conversion, how to understand patient's language, how to use repertories, different repertories. But today I want to talk a little bit about clinical repertories, where the rubric conversion is very easy because they are clinical, so you can directly take the clinical terms or symptoms and directly find out remedies which are previously used by old masters for that particular disease or for that particular symptom. And I will show you few of very interesting rubrics which I have used. So let's start. Okay, so before understanding any repertory, we have to understand what is repertory. I know many of you, in fact, most of you know about repertory, but I guess there will be few people who are new to repertory and repertorization, so it is for them that repertory is an index of symptoms of materia medica. In a very simple language, I am telling you, this is a record of scientific proving which is reproduced and artistically arranged in a practical form, indicating the relative gradation of medicines to facilitate the quick selection of indicated medicine. So in simple terms, it's just an index where all the symptoms are listed. You can go to repertory, choose the symptoms which are there in your case, and look at the remedies which those symptoms cover. So this is the way where you just find out things. It's just like a dictionary or thesaurus. So it's an index of symptoms basically. Now let's go ahead. I just love this quote, and I can't tell you how much I believe in this. That you know, without repertory, I just cannot imagine my practice. Because if we really want to practice in a serious way, and if we want to individualize each and every case, then repertory is must. So Pierre Schmidt said this many years back, that no conscientious homeopathic doctor can practice homeopathy in a serious way without a repertory. In today's world we have more than 5000 remedies proved in homeopathy. In Hahnemann's time it was just 99, but still Hahnemann was using repertory. So you can just imagine how important repertory is for our practice. Now, like I said, that I want to talk about clinical repertories, but when we talk about clinical repertories, we need to understand what they are and where they are useful. So clinical repertories are those repertories which contain symptoms or conditions and corresponding group of medicines. So it will contain clinical conditions, that means disease names, and then also symptoms which will be common symptoms of the disease and sometimes unusual symptoms of the disease also. These repertories facilitate the selection of remedy on the basis of pathological similarity, causation, modalities, and concomitants, and they are not commonly used in the purpose of repertorization. However, the repertories can be used for repertorization of a case where clinical conditions are very prominent and they mask the characteristic. So if you are not getting a characteristic symptom, there is no point using a larger repertory. Okay, but if you're getting very prominent symptoms which are common symptoms of the disease, or which are just uh, symptoms of that clinical condition, you can definitely use clinical repertories, and I'm telling you, in many cases these repertories help a lot. So these cases need the help of clinical repertories for selecting the simillimum. So what is the scope of clinical repertories? Where would we use them? So cases where the mental and physical generals are lacking, but they are rich in common symptoms. Okay. Then cases with only clinical diagnosis. For example, somebody comes to you, he says that, I feel very weak, I have diabetes, my sugar is so and so, and my thirst is also high. So this polydipsia, weakness, maybe polyphagia, these are all common symptoms of diabetes. What will we do? Okay, we cannot go to a larger repertory and look at a bigger rubric, but we can just go to a clinical repertory, look for diabetes medicines, and accordingly, according to general symptoms, we can prescribe. So sorry for the interruption. Uh, so there are a lot of things where, in a lot of cases where we can use clinical repertory, like short cases with few symptoms. They are used as a quick reference book at bedside, and they also contain some rubrics which are generally not given in other repertories, so they can become a good companion in the study of such rubrics. So if you are solving a case with some other repertory and you're not getting any symptom, which is not given in rubric form in that repertory, you can just use these clinical repertories as a companion book. They also help us to find the most appropriate palliative medicine in incurable cases. There are so many cases where we can't provide complete cure because it's either the case is incurable or they are at very advanced stage or something like that. In those cases also, because we have to give the remedy to reduce the pain, to palliate the case, to reduce the symptoms which are there. So these repertories can be helpful in such cases as well. There are many regional repertories. They are also very helpful in finding out the simillimum in specific clinical condition. For example, you must have heard the name of Bell's diarrhea. So it is a regional repertory which is only for diarrhea remedies. Okay, so this could be also useful. Now, if we are using clinical repertory, we should know the limitation as well. So limitation is just one thing, that is, they can't be used for every case. They are, you have to use it for particular cases, and also their use is limited for reference book. Okay, not in every case or not in day-to-day practice you can use those repertories, but whenever you need clinical repertories, they are immensely helpful. Let's look at few clinical repertories. So when we are talking about clinical repertories, we cannot forget John Henry Clark. His book name is also The Clinical Repertory to the Dictionary of Materia Medica by John Henry Clark. And this is such a gem, I am telling you. I will show you few cases which I solved using this particular repertory, and also I learned few new rubrics through this repertory. So if you want to understand the usage of any repertory, you have to understand the plan and construction of the repertory before using it. That's why I'm just telling you in short that how this repertory is built. So it includes 5 main chapters. One is clinical repertory, then second chapter is repertory of causation, where all the causes are listed, then repertory of temperaments, disposition, constitution, states, and then fourth chapter is repertory of clinical relationship and repertory of natural relationship, where all the interrelationship of the remedies are listed in a natural order. But we will today talk about first three of them, which I have used very often, and I'll share with you that how did I use it. So clinical repertory presented here, the first chapter of the Clark repertory is clinical repertory, which constitutes the index to the heading of clinical in the dictionary of practical materia medica. So in the dictionary, every drug, in the dictionary where Clark has listed all the remedies. Every drug is described from a number of different point of view. So the clinical point of view is one of these, and under the heading clinical, Clark has prefixed to each remedy a list of the affections in which it has been found most frequently indicated. So in this clinical repertory, okay, clinical in the dictionary of practical materia medica, you will get remedies which are frequently indicated for those clinical conditions or diseases. This is a very, very important part of clinical repertory by Clark. I will show you the practical example also. So look at this. This is how it looks. Okay, there's alphabetical repertory. So for example, in abdomen, you can see the subrubrics. Abdomen in coldness, abdomen distended. So there are 7 remedies. But these 7 remedies, or whatever remedies given here, are mostly indicated for that kind of condition. Okay, so let's look at few interesting rubrics. I will show you one case where you will understand that how you can use this repertory. So this was a female of 34 years old. She was primi gravida, pregnant for the first time, and she has a pregnancy of 16 weeks. And her main complaint was she had bad pain in the breast since she is pregnant. So this pain in the breast was not there before pregnancy. It was even not a symptom before or during or after menses. So it is a new symptom which she got after she got pregnant. And rest, she was fine. She didn't have any other trouble. I tried getting more symptoms, but I could not, except this pain in the breast along with some weakness and little bit of vertigo on and off. So at times she feels little dizzy, and that's all. So what do we do in such cases? Okay, so because it was a very clinical case, I didn't have much which I can take in the repertory, or I can prescribe something. I just went to Clark's repertory. I saw pregnancy and I got this rubric. This is such a beautiful rubric, and thankfully it has only single remedy. So I didn't have any confusion. So pregnancy, breasts, painful during. Okay, and conayam is there, and we all know that conayam is a remedy for tender breast, for heaviness, for stony nodules and all those things. And the cherry on the cake was she had a little bit of vertigo, which I could not understand otherwise. So I guess that was because of the conayam condition. So I gave conayam and she felt completely all right. Her whole pregnancy after this remedy was normal without having any pain. So pregnancy, breast, painful during, and the remedy was conayam 200. I just give 2 doses and that helped her. Then look at these rubrics. These are few interesting rubrics which I will share with you. So children diseases of, okay, and the remedy is pedis, which we don't think about. It is a lice, okay. Then nyctalopia. Okay, this is also a very clinical rubric which we don't get in other repertories generally. Bed sores, 11 remedies for bed sores. And very surprisingly, it has remedies like hyposanium, valeriana, fluoric acid. Then dengue fever. If you don't have any characteristic symptom in dengue fever, and if you have only few common ones like there is positive test of dengue antigen, or there is only body ache or some weakness and fever, you can think about these 4 remedies and just prescribe whatever goes with your case. Look at this rubric. Cachexia cancerous. There are so many people who are suffering from cancer and they become very thin. They just lose the whole mass of their body. You can use this rubric. Cachexia cancerous, and the remedy is picric acid, which is a great remedy for cancerous affections. Then cachexia of quinine. Again, only 3 remedies. Look at this rubric. Such a nice rubric. Change of life. So whenever there is big change in life, like climaxes, menarche, or pregnancy or delivery or any big change, you can think about these 16 remedies which are given in clinical repertory. Ringworm, 23 remedies. This is a great book where you can retrospectively also learn about remedies which are listed in that clinical condition. You just go back to the materia medica and learn those remedies, and it will give you a good insight about how they are used in particular disease. Next case. So this was also a very interesting case. This boy, 20 years old, male, he had abdominal pain all over the abdomen. It was a very acute case, and when he came to me, I remember it was a very bad condition. He was in so much of pain, and he told me, he said, doctor, yesterday I had my dinner, and after that this pain started. I had eggs in the dinner, and I guess I could not understand it, but I guess it was spoiled. So he had this spoiled food in his dinner, and after that it started. And he had little bit of nausea and little bit of restlessness, obviously because of the food poisoning. So what will we do in such a case? Do you have any idea that what will we do? Shall we give arsenic or some remedy directly? Yes, we can do that, but if we go to repertory and check, it is a better option. So we don't have any modalities in this case. We have no other symptoms, but we know that cause is there, and cause is very clear because patient himself is telling you. So what do? We have a whole chapter of causation in Clark repertory. So go to that chapter, go to causation. And I never knew that this type of rubric could also exist. I never knew that. So I just used the search option of the software and I just searched X, and I got this bad X in causes. Okay, I took that rubric, and thankfully here also it was a single remedy rubric. So carbo veg was the remedy. And safer side, I also took causes bad food, and both had only one remedy, carbo veg. I prescribed this remedy, and the pain vanished within few hours. And within 1 or 2 days, the patient was completely better. How surprising! Okay, let's look at some other interesting rubrics. You never think about remedies like simicifuga and calibrome for business embarrassment. So I remember in one of my case, patient came to me and he told me that he had a very important meeting, and this meeting was with some of his investor or something. He's a business person, and he said, this meeting went he was expecting a lot from this meeting, but it did not go well, and he was very upset about the meeting. And he said, I could not present well, I could not do that, and I will have a lot of business loss because of that. So it was a business embarrassment for him, just in that meeting. And when I look at, he had some digestive issue, some acidity or something. I just went to the repertory, I saw this rubric, and when I saw calibrome and simicifuga, I just went back and read these remedies, and I prescribed calibrome to him because he had a lot of fourth row characteristics as well. But this was really a new way of prescribing for me. Similarly, can you look at the rubric business losses? Again, calibrome is given. Okay, let's go ahead. Whenever you have a patient who says that, doctor, whenever temperature changes, if it becomes cold, damp, then I will have problem, you can use this rubric. Cold, damp weather. If a person has trouble because of the damp weather and that is cold, 2 remedies. Okay, let's look at one more case. This is a female of 25 years old, amenorrhea since 2 months. This is also a very, this was an acute case for me because she did not have any history of hormonal imbalance, PCOD, or pregnancy, or nothing like that. This girl, this specific case taught me a lot, about clinical repertories, about how to understand a person. So she has a complaint of amenorrhea from 2 months. She said my period came exactly 2 months back. That time I was traveling, and and she is a sport person, so she keeps on, keeps going to tracks and all those things. So she said I was doing a track in Himalaya, and we went to a lake, and I was there inside the lake because I love playing with water. बहुत अच्छा लगता है पानी में रहना. So she was in the lake for a very long time, and she said, I was standing there, I was playing there. I just put my legs into this cold water, and I was sitting there for 2-3 hours. And doctor, I cannot tell you that I just love doing this. And in on that day, I saw that my it was the third day of my period, so generally my flow is very heavy. But when I went up, I saw that my periods were very scanty. It became scanty, my flow reduced, and next day it stopped completely. So initially I thought it is because of the exertion, but then there was second thought in my mind that due to exertion actually the flow should increase. Okay, but few people told me that it's okay, and I just forgot about it. But she also told me that usually my cycle is 5 to 6 days long. It is not that short. Okay, but this time, last time when it came, it just stopped in four days, and I thought it could be because of the exertion. But ideally, I still think that it should have increased, but it stopped. But then someone told me, okay, wait. So I kept waiting, but it's been 2 months, and I'm not, getting my period. And she also checked with the gynac, so there was no signs of, cystic ovaries or anything, any other pathology which could cause this amenorrhea. So she told me, it never happened to me, doctor. My periods were always regular. She is a very lean, thin lady, and she always had very regular periods. No changes in that. But this time, for the first time, she said, my periods are delayed for 2 months. I'm really worried. So what did I do? I just went into the repertory. I took this because the cause was very clear. So she said, I went up, I was in water. Though she's not saying that this was the cause, but she told me the whole story, and I could understand that, okay, being wet sometimes, just reduces the flow. So I took this female wet after getting feet, menses late, too late after getting wet feet, and I got pulsatilla, and I happily prescribed it, pulsatilla 1, but nothing happened. Okay, no menses. Another month went off. Now it's been 3 months. She doesn't have menses, and she's very worried because it never happened to her. I also could not understand anything. So what did I do? I learned something new here. I learned that if you want new result, you have to apply some new technique, and that will give you the result. And you have to think innovatively and understand the case completely, and then only you go ahead. Otherwise, you'll be lost in this trial and error. So here I knew the cause, so I thought, let's try clinical repertory because cause is very clear. So what was the cause? Standing in cold water for long, because she loves doing it, feet wet. Other than that, we don't have anything which we can take as an anchor. So I took that. I went to causes chapter of Clark's repertory, and I got this rubric, which was a very interesting rubric, cold water standing in. Okay, and again one remedy was there, Magfos. So I gave Magfos 1 dose. I called her after 15 days because still I didn't have that much of confidence because I have already failed. So I said, okay, meet me after 15 days, let's see what happens. She came to me and she said, doctor, the period came within 3 or 4 days of the doses. तीसरे चौथे दिन आ गया. They were very heavy. I had very, very heavy bleeding. And it stopped within 6-7 days, and I'm quite okay now, no problem. And then I followed up her for other, like, the next 2 months. Her periods were regular, she didn't have any complaint, and she was completely normal with 1 dose of Macfos 1M. So this is how clinical repertories help you in such cases where you get stuck. Okay, look at some more interesting rubrics. So you um, you know, I have seen many cases where patients come after operations of fistula and they say, you know, I have heaviness, I have little bit of pain, or you know, this discomfort. So this is a very common complaint, and I get this rubric in Clark repertory, which is a very interesting rubric: operations for fistula. So after, you know, what is the cause of the problem? Operations, and only remedy, calcarea falls. Then there is a chapter of temperaments, okay, where um, the author has described the type of a person, temperament of a person, age of a person, lot of things. So you know, it's a kind of a type of person which you can take into consideration. So here the remedies have been found to act most beneficially in certain types of people, temperament, sex and age, and they are also included complaints and conditions of particular types of persons and constitutions. So this section becomes a uh, um, um, very much complementary to the clinical repertory. You can use this section as a complementary and not you know, directly to prescribe. But yes, in few cases that is also a case. So look at the rubrics. Angry and excited persons inclined to get. So people who are, you know, inclined to be angry or excited, you can use um, this rubric. Then broken down appearance of sore throat, murk sinatum, where the throat is completely, it looks very bad, looks broken down. Cachectic appearance of women, very particular, of women, cecal cord. Changes of season affections which come with, okay, if someone complains of sneezing, allergy, skin trouble, you know, the stomach problem, anything, digestive issue, if that comes with change in the season, use this rubric. There are many people, many patients who are slow, you know, you can actually observe that they are slow in everything, so you can take this rubric: slow torpid constitution. Psychotic or lethic diathesis, dark haired persons of. See, weak is the main super rubric and then sub rubrics. Weak children with well developed heads, weak digestion of elderly people, weak limbed children, many sub rubrics, and very interesting remedies as well. Okay, so you know, while we are talking about this particular slide, I'll also share one of the case with you. So this was also a case which I solved with Clark's repertory, especially with temperament chapter. So this is a case of male, 80 years old, with indigestion, acidity and constipation. He's a known case of heart trouble, BP, hypertension, and his bypass graft was also done many years back. And what is his complaint? This indigestion, acidity, and also a little bit of constipation, and he has on and off cough, which is mostly in night. And he said that, you know, doctor, maybe it is because of the acidity, the acid reflux. So this is the case. So what did I do? I just, you know, saw this particular rubric: weak digestion of elderly people. Can you see prunus? Okay, virginiana. So prunus virginiana I prescribed because I saw that rubric, and that was very apt because he had weak digestion due to aging and cough which is on and off, which is aggravated at night. And prunus is a very good remedy for persistent and annoying cough, especially worse at night. This is also a great remedy for heart. So we know, you know, as a complementary thing, patient already had heart trouble. So when you look at Boric writes, this is a wild cherry, Prunus virginiana. It is a heart tonic, relieves the flagging and distended ventricles, irritable heart, dilatation of heart, cough which is worse at night, and especially on lying down, with weak digestion, especially in elderly people. What was our chief complaint? 80 years old with indigestion and constipation. Elderly people. And this remedy, prunus, which, you know, otherwise I would not have prescribed ever, helped this patient a lot. a lot. He got better. His digestion became normal, almost normal. On and off he had, and his cough vanished completely. Okay, which is a kind of a cardiac cough. So this is the beauty of Clark's repertory. So where will you use Clark repertory? Where there are cases with one or two specific disease symptoms, where there are no mental generals or physical generals, but the case is rich in common symptoms of the disease, where the clinical diagnosis is clear, or where you have short cases like I showed you, such cases where you have very few symptoms, and also as a reference book, or to find out rubrics which are not given otherwise in other repertories. In all such cases you can use Clark's repertory. Let's look at one more clinical repertory which we cannot forget. We all use it, and it is also one of the very important repertories in clinical section. Boric repertory. So this Boric repertory is written by Oscar Eugene Boric and not William Boric. So because they're both, the names are similar, it creates confusion. But you can get this repertory easily behind the Boric's Materia Medica. It's like compiled together. So these are the chapters of Boric repertory. This is how it looks. Arrangement, we should know the plan and construction. That's why arrangement is very important. So how the remedies, how the rubrics are given in Boric: cause, first of all cause, then type, then location, character of pain, then concomitant, modality, and then aggravation, amelioration. So in each chapter you will see the rubrics are arranged alphabetically, okay, with this type of arrangement. I love this rubric, this particular super rubric, prophylactics for, and only Boric gives you that. Okay, so especially after post-COVID era, all are looking for prophylactics, isn't it? So you can give these remedies as prophylactic, as preventive in few diseases which is mentioned by Boric repertory. Then let's look at some phenomenal rubrics. These are single remedy rubrics in Boric repertory. Let's have a look. I was so shocked to see this rubric, that amelioration by combing hair, and the remedy is formica. Okay, so if someone tells you that, doctor, whenever I comb my hair I feel better, this is the rubric which you need to take. Menstruation concomitants asthma. I had one very bad case where a patient used to get asthmatic attack during menses, and spongia helped her a lot. So menstruation concomitants asthma in female chapter. Look at this rubric: uterus hemorrhage flow in paroxysms with bright red joint pains with. So if somebody has joint pains, bright red bleeding, which is happening in episodes, you can think about Sabina as remedy. Heart palpitation, children growing too fast wrong. You might have seen children, 12 years, 13 years old boy, having a height of 5.5, and they are growing very fast, and sometimes they experience this palpitation of the heart. This is a very good remedy. Acid phos. Coccyx burning on touch. Carboanimalis. Then in mind chapter, fears rain. We all know that nausea, fear, rain a lot, but this is a single remedy rubric. Then in nerves chapter, neuralgia, location, sciatica, acute cases. I'm telling you, I've used this rubric in many of my cases where I don't have any clue, and I know that this is sciatica, this is a very acute pain, patient needs immediate relief. I would go and use one of these remedies, whichever I feel is closer to the patient. So where to use? Of course, for prophylactics, a big yes. For one-sided diseases, to prescribe on the basis of clinical diagnosis when definite cause is not known. Okay, if cause is known, go to Clark. If cause is not known, you have clinical condition, go to Boric. This is how you switch over the repertories. If you want to prescribe on the basis of pathological generals, for the prescription of toxicological effects, and for acute cases with short 2-3 symptoms, then Boric is very useful. There are many clinical repertories. Okay, I have attempted to show you few of them, and today I want to introduce you, two new repertories which are relatively newer, and they are very interesting. So I just want to motivate all of you to to go for new repertories and explore them and learn them, and please share with me as well. So let's talk about Isa Yaga repertory or Easy Yaga repertory. This is a relatively very new repertory, and it has all the clinical sections like psychiatry, cerebrovascular diseases, ENT, GI, hepatic. So, with the nomenclature only, you will understand this is a new repertory. So, here the remedies are clinically tested, verified by the author, and given under different subrubrics. So, brain concussion, head after injuries of the head. So if somebody has brain concussion after injury to the head, you can think about these 17 remedies according to Isayaga repertory. Many such rubrics you will get in this repertory. Look at this. Psoriasis, skin eruptions, scaly. There are 54 remedies. Then in neuro chapter, okay, neurology, general progressive paralysis, face paralysis. I have used this repertory in Bell's palsy, in clinical conditions where you don't have much, you don't have many symptoms. These type of repertories are very very helpful. Manic depressive psychosis, depressive stage. Can you see? There will be different stages according to new staging or new differentiation of the disease. There are two remedies mentioned, Aurum and Myrrh. Similarly, there are so many sub-rubrics. Children's symptoms. There are many cases where young children, young infants come with inguinal hernia. Okay, this could be a very useful rubric for those. Children's symptoms: hernia inguinal in children. Only 4 remedies. And also look at the sub-rubric. If it is left-sided, nux vomica. If it is right-sided, there are 2, Aurum and like. It makes your job very easy. Children's symptoms: bladder retention of urine in newborn infants. Many cases I have solved where the child just retains the urine. Okay, and there is no cure to it. Now, next repertory which I want to introduce to all of you, but with a caution that this is a very new repertory. I am also exploring this repertory, um, and it has many drugs which would be very rare for you, but still it's always good to explore some new literature and understand that uh, how homeopaths use them creatively and innovatively. So let's look at Marsh clinical repertory. So these are the chapters of Marsh clinical repertory: CNS, CVS, hematology, eyes, vision, kidney, bladder, etc. And I want to tell you, this repertory is a very unique one, very very interesting, because it does not list down the conventional homeopathic medicines, but it would give you the allopathic medicines which are proved in homeopathy, either proved or potentized in homeopathy, and it will give you those allopathic medicines only. Some old medicines also you will get, but most of them are either chemicals which are potentized, or like hormones, or some new drugs. And most of the remedies are allopathic remedies which are homeopathically potentized and proved. Okay, so for example, if you look at this rubric in CNS, amnesia, he has listed remedies like diazepam, okay, and other remedies. You can just refer to Marsh clinical drugs, which is a materia medica book where you will get all those drugs. Then for impotence, see, these are all allopathic drugs. Acne, for acne, he has listed progesterone, which is a hormone. Then lithium bulb, which is a non-homeopathic medicine, but along with that, lot of new allopathic drugs, which we generally don't use. Adenopathy. So what is adenopathy? It means the swelling of lymphatic system or lymphatic glands. That is called as adenopathy. So the drug here listed is carbamazepine. Okay, carbamazepine, we all know that this is a drug which is used in allopathy for many diseases. So if you want to have a look at the materia medica, I am just showing you a clip. So this is from Marsh Clinical Drugs, which is a materia medica book. So there he says that it is a drug which is used for anticonvulsant, for anti-epileptics, and all the symptoms are listed here. Like in CNS, it has aseptic meningitis, behavioral changes, difficulty in speaking, speech slur, mental depression, etc., etc. And this is how you can refer and prescribe those remedies. So it is very important to use repertory on a regular basis. And what is the importance of repertory? Many uh, um, many things it solves for you. So there are many advantages. So first and foremost is it frees us. It gives you freedom from prejudice. It just frees us from our conventional thought process. It frees you from the prescription of only polychrist remedies. If we rely on our memory, we would just prescribe less than, I would say, 50 remedies, not more than that, because that is, this much we can remember easily. Or if somebody is very intelligent or very good with memory, they might prescribe 100 200, but not more than that. So what should we do? We should actually regularly refer repertories and materia medicas to be able to uh, prescribe newer remedies, or I should say to prescribe in an unprejudiced way. It also helps us to form questions during case taking. So if you are thinking about some remedy, or some remedy is coming up in your repertory chart, you can ask questions which can clear your confusion, or which can just verify the remedy. It helps you to prescribe the unknown drugs you even which you even have not heard about or read in the materia medica. Like for example, carbamazepine. I never heard about this remedy. I never saw the materia medica of this remedy. But I could prescribe this if I use Marsh clinical repertory. Okay, this is the beauty of repertory. And also we can understand the materia medica in detailed way, in a retrospective way, through repertory. So there are a lot of advantages of using repertory, and repertory is very, 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 very important for practice. So at the end, I just want to say that for if you want to use repertory very well, you should know the structure of repertory plan and construction, and then you will be able to use it. Also, you need to know the rubrics. So daily rubric exercises helps to understand the repertory in depth, and helps us to use that whenever it is needed. Also, how to convert patient's language into rubric. So this can be also done through different exercises. And repertorization, which is based on evaluation. So we should know the evaluation part, differentiation of remedies, and then finally you can prescribe the most similar one. So there are two ways of learning repertory and rubrics. First way is to join this course, which you have already done. So you are already doing the online repertory training course, which is great. I congratulate each one of you. And I'm also a beneficiary of this program, because this has really opened new avenues of using repertory in different cases. And second thing which you can do is solving cases and using repertory on day to day basis. Even if you fail, okay, even if you are not able to understand that thing completely, please use it as often as possible. If you use it 10 times, 15 times, 20 times in a day, one day repertory will be a greatest friend of you. So this is how you understand rubrics and repertory. And this is what I wanted to share with all of you. I hope it it will be useful for you in your journey of understanding repertory. If you have any questions, concerns, you can just email me on this email, ashahomeopathicacademy@gmail.com. You can also leave your comment in the chat section, in the comment section below this video, and I will try to answer them whenever possible. Along with that, I really want to thank the whole ORTC team, especially Dr. Kalathia sir, for giving me this opportunity to share whatever I know with all of you. And the whole team is fabulous. I feel privileged to be part of this team. Thank you so much, sir, and thanks to every one of you, all the mentors and all the participants. You make this course successful, and it is a great platform to learn different repertories. So I'm really happy to be part of this. Thank you so much, and I hope that this would help you. Thank you.